Welcome to episode 21 of the Yoga Meets Movement Science podcast. Our topic of discussion today is the topic of asymmetry. Asymmetry. So, in general, there tends to be just this kind of intuitive belief or bias that I'm sure most of us probably share or can relate to, which is just this belief that things are just more ideal or more optimal, especially when it comes to like the human body, when things are symmetrical, meaning like the same side to side. And there's just kind of this intuitive idea that when things are asymmetrical or different side to side, and this might be in like how someone's body looks or like is aligned. It also might be in terms of more like movement, like how the body moves side to side. But there are ideas that when the two sides are different or asymmetrical, that this can predispose someone to or increase their likelihood of things like pain, injury. Sometimes I even hear like health claims, like that when things are asymmetrical, it can be like even bigger than that. So anyway, there's just this bias that symmetry is optimal and ideal, and asymmetry is like leads to dysfunction and is non-optimal. So that's what we're here to talk about today, because this topic, it comes into play in so many of the fields that like Travis and I are part of and tune into. And for starters, the yoga world, in my experience in yoga, and I think Travis would share in this as well, but as far as symmetry goes, I tend to experience that like that these ideas that when we practice yoga or take a yoga class, that it's really important that we always do the same thing on both sides. So that's kind of one, like our sequences need to be symmetrical, and we'd be left imbalanced if we didn't do the same thing on both sides. And then these ideas about symmetry also come into play, like I mentioned earlier, but just in terms of like how one aligns their body, and if they have certain, differences in alignment side to side, there are these ideas that can be lead to pain and dysfunction. That kind of falls more in the realm of maybe like physiotherapy or physical therapy, I would say. Whereas what I just talked about with thinking about yoga sequences side to side is kind of more yoga or like movement classes in general. And then another place that symmetry can come into, or another field that symmetry comes into play, is kind of more in the strength and conditioning or like the fitness side. And in that realm, we often hear just discussions about things like symmetry and asymmetry in terms of, say, side to side differences for strength. Like, what if your right arm is stronger than your left arm? Or range of motion. Maybe your right hip is more mobile than your left hip, things like that. So I think there are a lot of discussions about asymmetry in these fields, and whether having these asymmetries can lead someone to be more likely to experience an injury, like maybe when strength training or when practicing their sport or any athletic endeavor. So those are kind of like these realms that this topic can arise in, at least in what Travis and I tend to tune into. That's kind of what we're planning to focus on today. And I wanted to just kind of start us off with, or just kind of establish the term symmetry and just what a technical definition for symmetry actually is. So this comes from a review paper by Maloney from 2019. And this was a paper that looked at the connection between asymmetry and athletic performance. But Maloney in this paper defined symmetry as the quality to demonstrate an exact correspondence of size, shape, and form when split along a given axis. So to me, when I hear that, to me that kind of comes across as like symmetry visually, like how something looks like form wise. But in what we're going to talk about today, we're kind of expanding that definition of symmetry to include things like movement and motor abilities, like actually how the body might move, and symmetry in that sense too. So just super briefly, our plan for what we're going to talk about today. Our plan is to first take a look at body alignment and symmetry. So kind of like posture, things like that. Then we want to take a deeper look at symmetry and how it comes into play in the yoga world and like in yoga classes. Then we want to take a look at symmetry in terms of more the movement, things like strength differences, range balance differences, things like that. And finally, we wanted to have Travis talk about his experience living in a body that actually is a significantly asymmetrical body. And for our listeners who actually maybe have only listened to our podcast and have never seen photos or videos of myself and of Travis, you might not know this about Travis, but he actually has a significant asymmetry in his body. And can you tell us about that, Travis? Like what that asymmetry is?
Sure. So I'm an amputee, but I was born an amputee. So I was born with a rare birth defect called proximal femoral focal deficiency. So for our anatomy lovers out there, proximal means close to the body, focal, I don't know why it's called focal. Femoral is the femur or thigh bone, and deficiency means the absence. So I was born without my left thigh.
Mhm.
I have a tibia and fibula, and I had a foot on the end of that leg, which I had amputated when I was 3. So I'm effectively an above the knee amputee, but my residual limb is not what would be typical for someone who is born with normal anatomy and then loses their leg traumatically above the knee because they would have a normal thigh,
Right.
whereas my hip
Oh, yeah.
structure is much wonkier because my tib fib kind of float in the acetabulum, but there's not like a very good joint articulation there. So my hip kind of is a little bulbous out to the
Right.
side, and I actually have the most severe classification of it. So there are 4 different classes, and
Oh,
mine
wow.
is the class 4 or class D, and so that's just like the almost complete or complete absence of the femur. The other, if you had lesser classifications, you might have some femur, and then your leg might only be a
Mhm.
little short. But my leg is about half the length as
Length.
my short leg is about half as long as my long leg. So I wear a prosthetic leg to walk
Mhm.
that includes a prosthetic knee and a prosthetic ankle foot.
Wow. Thank you for describing that for us. I think you really like thoroughly explained. And I think that's interesting because you mentioned like the acetabulum, which is that's the hip socket in the pelvis, like where normally like the head of the femur, like that ball would articulate, and that makes the hip joint. So for you, you don't have the head of the femur because you
Right. I
have
don't have a femur. Yeah.
yeah.
So it just kind of all goes together. It's
Mm-hmm.
really more of a knee at my hip,
Oh wow.
because it's the tib and fib. I haven't looked at the X-rays in a while, and like
Yeah.
I'm not even sure what the musculature is. Like, is the muscle like I feel a muscle in the back of my residual limb, but is that gastrocnemius, or is that hamstring, or is it
Right.
some
Glutes?
some? There's definitely
Oh, you mean
glutes.
like sorry, you
Yeah,
mean like
lower down.
lower. Yeah, yeah.
Yeah, yeah. And I have
Oh,
like
that's so
hip flexors, but are
yeah.
they? Is that rectus femoris?
Oh,
I
right,
guess
or like
I probably
iliacus.
is. Yeah, definitely those things because I'm not affected anywhere above the hip or waist,
Mhm,
and
mhm.
since that kind of originates
Right.
higher up.
I
Um,
see.
but also, like, what is a muscle? Like, we kind of
We talked
we
about that
we
before, right?
we make these like definitions for it, but if your body has developed differently, then who
Absolutely.
knows?
Your brain can sense all of your different muscle
Yeah.
fibers and how
So
it
yeah, so I can articulate my quote unquote hip in all of the different directions of abduction, adduction. So bring the leg in and out in the frontal plane, and then
mhm,
flexion extension, and
and
rotation,
rotation.
internal and external. But my range of motion for some of those movements isn't that great,
Mhm, mhm.
especially my active range of motion. But that's just because my hip is inherently weaker than the average hip.
Right.
And but yeah, even like passive hip flexion, I only can go so far. So then
Mhm,
I my I start to pelvic tilt because I run out of hip flexion. So
mhm.
like in my chair pose that we talked
Yep,
about in
mhm.
a previous
Like I
episode,
think
like
last
I,
episode.
I tend to tuck fairly early on in the range of
Mhm.
motion, which is fine,
I
as we
remember
discussed.
in one of our really earlier collaborations together, we did some, oh, it was a video of you doing a sun salutation. And I don't know if you remember this, but we shared it through my social media and like someone
I
had
do
a,
remember
you,
this.
you do. Do you know what I'm going to, like their comment about your forward fold. And they were like, but what about his forward fold like that? They were like disapproving of as you forward folded into Uttanasana that your pelvis tucked under and your low back rounded.
Yeah.
And you remember that?
Yeah, you came to my defense.
I did. You're right. I did. I commented back to her. I tried to be, not like aggressive or angry, but I was just like, hello. He doesn't move necessarily the same as,
Maybe she's listening now and she has a better
yeah,
understanding. But
that's so
it's
true.
if someone had a different limb difference and they had a typical development of their hip socket, then there might not have been as anatomical, let's say, of a reason why that would be occurring compared to my limb difference being so atypical.
Hmm.
It just, not that it's ever correct to look at somebody and be like, you're doing it wrong, because you just don't
Right.
know the story.
Right.
But the case could be made for, in most cases like that person maybe could, if whatever was happening in someone with a normal hip anatomy,
Hmm.
maybe that would be atypical, or there,
Hmm.
that could be something that they maybe would want to try to address. But for me, I that's just how I am.
Right. Right. Totally. And so it's easy to make assumptions, I guess, when we look at other people and how they move. But absolutely. Well, we had a plan to find out a little bit more about your experience in your body and in like the yoga world and the fitness world, things like that. Maybe more toward the end of our conversation. We kind of have introduced it a little bit now because we have talked about that a bit. But but in talking about this kind of gives us a good segue into kind of our first major topic that we wanted to address with regard to asymmetry, which was body alignment and posture and
Mm-hmm.
how what people's bodies look like side to side. So I think this is a good way of kind of introducing that. You have a very significant asymmetry in terms of your alignment and also and your posture too, right, Travis? Like, I'm sorry, they're like the same, but like how you hold yourself versus like if you were just like lying down and someone looked at you, there's like that alignment, and then there's posture, like how your nervous
Mm-hmm.
system arranges you. But there are necessarily some asymmetries there as well, right? As
Totally.
far as how you hold yourself. Yeah. And so we wanted to take a look at that in general because we find that alignment and posture tend to be things that people think of when someone has, say, like pain in their body. It that pain, and we're talking kind of chronic pain that lasts longer. We're not talking so much about like an acute injury, which that's generally short term, but people who have, and this is a great many people, it's like the most common type of pain is longer term chronic pain. And quite often there's this belief that when people have pain, we can blame it on something like body alignment or posture. And there are many different ways to think about body alignment or posture. Today, we really just want to think about the idea of symmetry and like things looking different side to
Mm-hmm.
side. So, right, because there are a lot of different ways we could think about that's just bad posture, blah blah blah. But just these ideas that if someone were to be symmetrical from side to side or quote balanced, if they looked the same side to side, then they would naturally avoid pain. Like these ideas.
Yep.
And there are a lot of examples of those in the body. Like maybe someone has one shoulder higher than the other, one side of the
Mm-hmm.
pelvis. Like there are a lot. We wanted to pull out just as a good example because we think many people can relate to this. The example of a leg length discrepancy.
Right. Which I have one.
Travis,
I have a
you
very, very significant leg length discrepancy.
you
So much so that part of my leg is missing.
Oh my gosh. Yes. And you wear a prosthesis to make up for that, to like even
Right.
things out.
Right. Which is maybe a more extreme example than most people think of when they think of a leg
Absolutely.
length discrepancy.
Absolutely. So yours is kind of an exceptional leg length
Yeah.
discrepancy, but
Although, to be honest, I do think when I was born, that is a measurement that the doctors take to try, even
oh yeah.
for even for people who are like clearly missing half of a leg, like, well, what's the difference, in
Mm-hmm.
inches or in percentage, and then that's maybe how they start to classify you, and then further with X-ray, like into the different classes of proximal femoral focal deficiency or whatever it is. Because the one thing I should have mentioned is, like, for those lower classifications, they might not there might not be a surgical intervention. For instance, if the leg length discrepancy was small, actually, this would be a surgical intervention. They can do bone lengthening, where they put
Oh
like
yeah.
these internal fixations in, and then the bone
To
grows.
stimulate the bone to grow longer.
Yeah, so you can try to even that out. And then also, like, people just sometimes will walk with a larger
Oh
uh
yeah.
foot.
Like
What's the word?
a heel lift?
Yeah, but it
Or
would, it would actually be throughout the whole sole of the. It might just be like a shoe that's built up an inch on the bottom.
yes. Yes. Like a
And so
specially made
that's,
shoe.
yeah. So that's, if
Gosh, yeah.
the leg length discrepancy is small, then you can, well, even small to somewhat, like, I've seen people with 6 inch or 10 inch or 12, like big,
Right.
big, big buildups, to
To even
even
out.
things out without going the amputation route,
Right. That makes so there are
or
these
without going the
other
prosthetic route.
right. Right. Just shoe height, like different shoe
Hmm.
heights to kind of even things out. That makes a lot of
Yeah.
sense. And then those are definitely more like on the larger side of leg length discrepancies. We
Right.
also have these kind of, especially compared to that, they just seem super minor. But there are these more minor measurements of leg length discrepancies that are in the millimeters, basically. It's
Hmm.
like somewhere like like if your legs are the same, that's millimeter difference, but it can go up to like 20 millimeters, something like
I,
that, or more.
I I see this fairly commonly measured, but that might
Hmm.
just be the circles that I run in. So I'm wondering,
Oh
like,
yeah.
have you seen the measurement for the leg length discrepancy, or ever had it done to you? So
I
you're usually lying on your back, and something happens. Your legs get like kind of shaken out, like you're supposed to be loosey goosey, and then you
right.
get pulled to the edge of the table,
Oh yeah,
and
yeah, yeah.
the clinician or therapist looks down and they say, "Oh, looks like you have one leg's longer than the other. I'm gonna say that's about an inch."
Right, and they just kind of eyeball. They just like look at you lying there with your feet at the edge, and then they eyeball it.
Hmm.
Like, God. So they
Hmm.
must compare what, like the feet, whether they're side to side with
Yeah,
like the
that's it.
pelvis, or they go
Well,
up to the
I
pelvis
don't
and
know
they're
if
like,
that matters. Because
you.
it could be, you can measure the leg length. You can measure leg length as the distance
Mm,
from the greater trochanter to the medial or lateral malleolus, so
which
hip
those
to
are the
ankle,
ankle, yeah.
and that's how you measure leg length. And you could do that on both sides, but when they're looking at a leg length discrepancy, they're just saying, well, when you're on your back in supine, if your feet don't
Right.
meet
Oh, I
the
see what you're
same,
saying.
if they're not even with each other, it doesn't matter whether it came from a true bone length difference
Mm-hmm.
or
Mm-hmm.
whether it was something at the hip that was then causing it. It's just, this is the result of everything that's happening above. I see that you have a 1 or 2 inch difference. And then they'll do some sort of hocus pocus and they'll remeasure it and they say,
They
"See,
will. Like what,
we fixed
Travis?
your
What will they
leg length."
do? What will they?
Uh,
What's an example of what they'll do?
they could do anything. They
Some
could
like fascial really quote release. They
they
might do
could
that.
release your fascia. They could
Activate
reset
muscles.
They
Sorry,
could
I'm interrupting you.
reset your pelvis
Yes.
with some
They
manual therapy. They
right.
could do some muscle activation. Um, they could, I don't know, spin the tail on the donkey, and then they measure it
Totally.
twice, and
Right.
perfect. Now
They
you're all
measured at
fixed
the
up.
end and they're like, now your feet are even. I fixed you. Like you
Yep.
were broken. There was something wrong with you. I fixed you. And like,
Yeah, but you'll have to come back again two
mhm.
times a week. We'll keep,
So I
because
keep realigning
you're
you.
gonna go out. Yeah,
Hmm.
your leg length is gonna get all whacked up again if you
So
keep living your life.
I know we're talking about, you and I are talking about this a little bit, like we're sarcastically or like kind of like we're joking. But I guess just to like
This is
establish
actually what
that
happens.
this is actually what happens. And for people who may not realize, like, I think there are a lot of people who that's just their regular experience when they go to, say, a chiropractor or their physical therapist. They might not know that these techniques are actually quite questioned, right, Travis?
Right. Yeah. Yeah, because a medical provider is giving you a diagnosis or a label or a finding of their assessment, and then they're doing an intervention that they themselves likely believe in,
Hmm.
and then
Hmm.
they're remeasuring you and seeing something different, and then you're maybe feeling something different, and
Hmm.
you're walking out all fixed up and feeling great. And so I don't want to discount that experience
The experience,
entirely,
right, right.
but I think we can. There's good evidence showing that all phases of that experience should be
Yes.
questioned.
Right. And that for sure someone could feel better after a treatment like that. Like, because assuming they went to the chiropractor, whoever the clinician is, assuming they went in with a painful complaint and that's why they're there, they might feel better afterward. But it's not necessarily the case that the reason they feel better is because the clinician realigned their leg length discrepancy. It could be so many things, aren't there? Like almost innumerable contextual factors that could come into play that could influence someone to feel better, because pain, as we know, is a complex multifactorial experience, and many different inputs aside from just like body alignment can affect it. So if you really trust your clinician and you really believe that what they're saying is true, and then they're telling you that you were misaligned and they put you back into alignment, they
Yeah, and they
fixed you,
put their hands
that's
on you. There's
yes,
neural
they
inputs
touched
there.
you. And there's just psychosocial like belief, like I believe you, like you're telling me I was out of alignment, now you're telling me I'm back in alignment, I should feel better. So there's
Mhm.
could we call that placebo? Would that is that I know placebo could be a
Yeah,
complicated term,
yeah,
but just like the idea
yeah,
that your belief in something being efficacious
yeah.
or having positive effects that can manifest in you actually feeling better without anything
Hmm.
actually really changing.
Yeah, expectation bias.
So I guess just to throw it out there, just in case people were wondering, like, why are they talking about these types of treatments? Like they're joking about them. It's just that it doesn't really, like, there's a lot of questioning of those types of techniques these days, and in general, that type of treating people for pain doesn't seem to be super support. It's not very evidence based because pain is
Hmm.
so complex.
Hmm.
So we were using the example of the leg length discrepancy because that's just a very common scapegoat or something that gets blamed for pain. It's like someone knows that they have pain, or a clinician knows you have pain. So then they just go about looking for something that looks off and then they blame it on that. And
Yeah.
leg length discrepancy is just such a common one. But what is actually known from research on leg length discrepancies is that 95% of people, like healthy people, 95% of us have a leg length discrepancy to a
Feels
certain
good to
degree.
be in the normal category.
Exactly. Exactly. So I think this is maybe a good place to point out that when we're talking about these asymmetries today, kind of keeping in mind that there is a difference between minor asymmetries and like major or more significant asymmetries.
Right.
And Travis, I feel like you're an example of like a major or very significant asymmetry.
Yeah.
Whereas a lot of the like blaming and fear mongering that comes in like the realms of yoga, movement, fitness, rehab is more in the minor asymmetry
I think
category,
that's
right?
the crux of the issue.
Isn't it? I'm glad you think so. Right. So I think what we're trying to raise awareness about and question is blaming people's pain, or the idea that they're going to have pain in the future if they have these
Mm.
asymmetries, blaming them on these minor asymmetries. I think that's important to kind of point out. So when we said, that clinicians will fix someone's asymmetry or lay them out on the table and look at their feet. And as you said, it's like they'll see like a difference of like it's like these small differences, right? That they
Hmm.
might see an
Maybe an
inch.
inch actually would be big,
I think
but
so.
they're seeing half an inch.
Or centimeters, or like a small, from some of the research I was looking at, it seems like pretty small distances.
Hmm. Hmm.
And so it's just these ideas that like I see this really tiny, like I need eagle eyes to see it, a difference in like your leg length, and that's making this huge impact in your body as far
Yeah, which
as
is
your
also,
pain.
if you just did the test 2 times in a row, maybe the other leg would come out longer the next time when you're talking about that
Right.
small of divisions,
Oh,
just
that's
because
a
of the
really
way
good
that your
point.
hips shifted on the table. It's just not a very repeatable
Totally.
test.
Right. Could you say that it's maybe not a very reliable test? Like it's not necessarily accurately telling you what you think it
Right.
is? Or
Yes,
just, yeah.
because yeah, so reliability is the reproducibility or repeatability of or consistency of a measurement, such that if you take it 2 times in a row, you get roughly the same measurement both times.
Okay, that makes sense. That makes sense. Right. So, in many cases of leg length discrepancies where that's kind of pulled out and blamed as a scapegoat for pain, in many cases, the difference is actually really tiny. And what we know is that 95% of healthy people, asymptomatic people, which means like they have no symptoms of pain in this context, they
Mm-hmm.
have leg length is like we almost all of us do up to a certain point. And from what I read, there's the research review that's like a two-parter, Knudsen 2005. We'll link it in the show notes, but it's anywhere up to like 20 millimeters, it seems, is like really normal leg length difference. And that's anywhere beyond 20 millimeters or 2 centimeters. That's considered like a little bit more like something that you may want to look at or consider when you're looking at what's going
Mm-hmm.
on in someone's
I think,
body.
and I think the conversion is 2.54 centimeters is 1 inch. So
Okay.
we're talking
Okay, yeah.
8 tenths of an inch.
That's right. So if someone has a leg length discrepancy that's greater than 8 tenths of an inch, then
Mm-hmm.
maybe research would suggest that that's something to consider when you're looking at what's going on for someone.
Mm-hmm.
But less than that, it's just like it's actually very normal in most people. Like we're not really symmetrical side to side. And it's just it's questionable because of that. That lets us know that it's really questionable that something like a leg length difference from side to side, a minor. Remember, we're kind of talking minor asymmetries. It's not very likely that something like that would actually be a main contributing factor to someone's pain. Do you think is that correct to say?
I agree.
Right. And keeping in mind, we're talking
As
minor.
an expert in leg
Yeah.
length discrepancies from personal experience,
That's right. That's right. You totally are. So we
don't
kind of
sweat a small leg length discrepancy.
precisely. And I think we can probably take this idea and apply it to so many other minor
Yeah,
asymmetries, right, in the body.
right, right. So we've talked about one leg being functionally longer than another, but
Mm-hmm.
there are many other anatomical alignments, right, or
Mm-hmm.
postures where the
Mm-hmm.
same basic rule applies.
That's right.
The
Where people will blame them for pain, but
Yeah, and usually those things are small. And
mm-hmm.
if they are really severe, then sure, that could be problematic. But in most
That's
cases,
right.
a lot of people are going to have small differences in
That's
it
right.
could be other things in the lower body, it could be things in the upper body.
And we mentioned a few examples, like one shoulder might be higher than the other, or if you look at someone's pelvis, like one side of the pelvis might be a little higher
Yeah.
than the
Yeah.
other.
People love to take those still shots against
Yes.
the grids in the PT
That's
clinics, and
right.
then there are whole apps for this. Like, oh, we're going to measure your posture. And
Mm-hmm. And like you're
what is that?
imbalanced because you're
Yeah,
ace.
you're
Yeah.
imbalanced because your right shoulder is
Mm-hmm.
1 millimeter lower than your left shoulder.
And that's why you have pain. Like it just, therefore, that's why you have
Right.
pain. Or
That's
if
why
you
you have pain,
don't,
or that you're gonna get pain. We have to fix that.
exactly. So I guess just really emphasizing this message that the human body, the human body is naturally variable, like from one another. Like we all fall. There's like a certain pattern that the human body follows, but there's so much variability between individuals.
Hmm.
But then within the same individual, it's completely natural for there to be asymmetry all through the body, right? Like
Right.
we're
Yeah.
not just like paper dolls that you
Yeah.
just like
Well,
cut in
even
half.
because our insides are different from left to right, right?
That's
So
right.
our internal organs, some of them are on the left, some of them are on the right, or at least more left than right.
100%. I feel like that's a huge realization. When I first learned that, I was like, "Whoa!" And it just, I could think we don't tend to learn. I mean, unless you've studied, anatomy, physiology in the body. I think people just assume because on the outside, superficially, we look like we're the same side to side. You might just
Hmm.
assume that inside we're the same side to side, but from our insides out, we're different. And it's that way on purpose. Like our organs, they function optimally, like in these asymmetrically placed positions. For example, right, Travis, like your liver is on the right in your body, and then your
Mm-hmm.
stomach and your spleen are on the left, right? It's not like they're not just all down along the center.
Mm-hmm.
Your two lungs are different. Like the left lung has two lobes and your right lung has three lobes. So they're not the same. Your heart is relatively kind of center, but it's actually like the bottom part of the heart is like curves off to the left. So it's like more pointed to the left.
And the different ventricles left and right have different functions,
Yeah.
right?
Right, right. They exactly. It's just not, yeah, it's not the same inside
Yeah.
side to
So
side.
why would it have to be the same on the outside?
Exactly. And that's like our internal organs, but there's also just and then I mentioned earlier we look at people and think superficially externally we're the same side to side. But if you actually like peer in and look closely at just anyone or yourself, like look at your face and draw a line down, you can see like your two eyes probably are slightly different, your ear, like things just, or your mouth, like the corners of your not nostril size and shape. That was one that when I was reading some research, one of the papers you sent me, they talked about
Mm-hmm.
nostril size, like it can be different side to side, and that's like normal.
Yeah.
So I mean, that's just when you get down to the details, you can really see that. Yeah, and that's just like the face, but what about like our bones and our joints in general?
Yeah. Well, so are they born perfectly symmetrical, and then when they adapt, do they stay
Mm.
perfectly symmetrical? And then if they don't, which they don't, why would we try to impose
That's right.
external artificial rules about trying to stand and move perfectly symmetrically?
Exactly. I think because it's like, as I mentioned way back in the intro, like it just seems intuitive, right? Like I think we just intuitively think symmetry just must be better, balance must be
Mm-hmm.
better.
Mm-hmm.
But it's really not taking into account, like you said, the way the body adapts, the way our genetics just determine like the form of our body. And yeah, often when people have asymmetries, like for example, say like one foot turns out more than the other, that's a really common one that's often
Mm-hmm.
spotted. And like someone like a physical therapist might try to quote correct that, and someone like you need to. That was what I was taught in that alignment
Yeah.
training I took, and then
Uh,
I tried to impose that on Craig, my husband, because he has pretty turned out feet. And I was like, yeah, that's going to lead, because I learned this stuff in the training. This isn't so much like asymmetry, but it's just more like the feet are not aligned straight forward.
right.
I had been taught that was going to lead to all of this like back pain and dysfunction. And I tried to get Craig to straighten his feet and point them forward.
Poor guy.
I know it
You
wasn't
didn't
good.
know any better. So at
Thanks for saying that.
a friend of mine did have an ace. He had one side that was turned out, and
A foot turned out.
yeah, he's a marathon runner,
Ooh.
and I don't know. I think it was he decided that he was going to try to fix this. I don't know that fix, quote unquote. I don't know that it was a
Oh, that
physical
someone told
therapist.
him.
Yeah, maybe, but anyway, he went into his new running season. He's like, I'm going to run with my right foot straight toed, and he got
Ooh.
hurt.
He did. He did. Sorry, not to
He
laugh. It's
got
not funny that he got hurt, but
he got like really hurt to the point where he needed a
oh,
lot of physical therapy, and
what?
he had to
What?
quit running for a little while. He's back now. He's doing great. He's now lets his toe do what it
Do what
wants
it
as far as
naturally
toeing out, and
does.
doesn't try to correct, quote unquote, something that doesn't need to be correcting, and actually turned out to be counterproductive to try to correct, because his hip orientation, what's that, anteversion, if you're more toed out?
I think I think that's retroversion. If you're more toed
Okay.
out, I get confused
Well,
on them, but
I don't
I
know
think
either.
it's
We'll
retroversion.
we'll let the
They're
people be the
confusing.
judge.
Yeah.
I actually had a student ask me that
Really?
in class last semester, and so I'm like, I don't know, I got to get back to you. And then I found some really great pictures, like top down, like cartoons of what
Oh
retroversion and
yes,
antiversion were,
yes.
and I
I know
included
what you're
them in my
talking about.
slides for the next class, and he didn't show up.
What?
He skipped the next class.
Travis. But he probably watched the
So,
recording, right? It was recorded.
well, just to finish
Yeah.
the story and give you all the weeds, we were reviewing for the exam on the next class period. So they're really, don't even know if I recorded it or if there was a need to watch the review. We just played
I
a
see
little
what you're
game.
saying.
So
So
anyway,
he
he
may
asked a
never have
great
known.
question. I couldn't answer it in the moment. I did my darndest to rectify
Yeah.
that, and then it was all for naught.
Well, at
Because
least,
I like got there ready, and I was like, "Hey, we have he's not here. Forget it."
well, I just love that though. I think it's great. Like it's so good to just know when you don't know something, and when someone asks you a question, the best thing you could do is say, I don't know, but I'm going to look into
It's
it and try to
true.
get you an answer.
It's
And that's
true.
what you
I
did.
don't know, but I'm gonna get back to you.
Right, exactly.
Or can you rephrase the question?
Right, right.
It's
But
a
in
good
any case,
obfuscator.
right, totally. So when someone's feet are turned out, and that seems to be pretty common in my experience. But there is also like what's colloquially called pigeon-toed, where like the feet turn in, which is kind of the other direction. But in general, there are these ideas that your feet should. Well, there's the idea that they should point straight forward, and that's that's just not the human body doesn't need to look like that. But then there are ideas about if they're asymmetrical. If one points out more than the other, then that's an asymmetry, and we need to correct that. And as we can see, that's probably not the case. Your body is probably long adapted to that being your alignment, and it knows how
Mm-hmm.
to, it absorbs the force well, and everything is good. And by imposing a change, like in that top down manner, sometimes we can do more harm than good, like your friend
Right,
who,
right. So my friend, when he was running, but I think that also applies in an exercise and yoga context too, in terms
mm-hmm,
of all the different foot positions, especially when you're talking about certain poses that have a prescribed somewhat alignment, right?
yes,
Where it's like, all right, toes forward for chair pose,
a hundred
or
percent.
feet hip width apart. And it's like,
Or
well, it might feel better to me to have my honestly, it does. Like, have my left toes forward and my right toes out, or my left leg slightly forward because I don't have dorsiflexion on my prosthetic ankle.
that's right.
And like, of course, I'm an extreme example, but it's fine to illustrate the idea
Mm-hmm.
that we don't
Mm-hmm.
need to be perfectly symmetrical, and an asymmetrical stance might just be what feels and is best
A
for us
hundred
in our
percent.
posture.
And thanks for mentioning that as far as yoga goes, because for sure these ideas about like symmetry totally are brought into yoga. And you describing that difference, like for you in chair pose, it brought up a memory for me of being. So my main yoga mentor is Jules Mitchell. Many of our listeners are probably familiar with her. She's super smart and amazing. But I was in her. I did my 500 hour with her, and I just remember you gave me a flashback to one day she was talking about Warrior Two,
Mm-hmm.
and Warrior Two, that's, 1 foot forward, 1 foot back. And it's always taught, I mean, generally taught that the back toes should angle forward a certain degree. So, so rather than that foot being parallel with the back edge of the mat, the toes should angle forward a certain amount, maybe 20 to 30 degrees. It kind of depends on who you're talking to. But she was just kind of showing like this one student in our class, and because of her hip structure, it just was much more comfortable for her to not only be in Warrior Two with the foot parallel to the back edge of the mat, but actually beyond that to have the toes pointing back, which is
Sure.
like, yeah, to a yoga teacher or a yoga student who's we're just,
Blasphemous.
it really, like, you could see the reactions to the people, like all of the trainees were
The
like, what are you
horror.
talking about? Like, you can't do Warrior Two with the toes pointing away from you, the back toes.
That's crazy.
It really, I
Red
mean, but
X. Red X.
yes. And what I think is maybe most notable about that is just the reactions of the students to hearing that, like, so entrenched in the yoga world and these ideas about it must be one way. And if you
Mm-hmm.
do, the pose, if it's an asymmetrical pose and you do it on both sides, it must be the same on both sides too.
Mm.
And if it isn't, there's something wrong, and you need to look at like what that imbalance is. Or in yoga,
Got
I
to
feel
get
like
that
this.
leg length discrepancy checked out.
Yeah, totally. There's also often in the yoga world questions about like range of motion. Flexibility tends to be a focus in yoga. So it'll
Mm-hmm.
be like when I do this, say it's a Jani Shirshasana, which is a one-legged forward fold. Well, like one leg is straight and then the other leg is folded in. That's Jani Shirshasana.
Mm-hmm.
I've seen this one as an example come up often because your hamstring stretching only on that one leg, and people will often remark that they're different on both sides. Like I can go further on this one side and less far, and like that must be like, what's wrong with me, and what do I
Mm-hmm.
need to do to like even that out. But
Mm-hmm.
it could just very well be it's just their structure or just the way that their body is like dictating how far they go. And it isn't necessarily something that's wrong and that needs to be fixed, right?
Yeah, it just depends. But how big
Mm-hmm.
of a difference is it? And is it really affecting them?
Mm-hmm. Exactly. Right. Just like you said,
Yeah.
because there's minor and there's major, right? Like those
Mm-hmm.
two general categories. But it just seems like people like to blow out of proportion the minor stuff and make it bigger than it is.
Mm-hmm.
So, with regard to yoga, kind of talking about alignment in yoga poses, there was also this idea that I mentioned earlier where I tend to see the symmetry question kind of come up a lot in the yoga world is in this idea that yoga sequences need to be taught so that everyone does, so that we do the same thing on both sides in yoga.
Mm-hmm.
We
And
all,
can't
yeah.
teachers like not sleep at night if they realize like they're going to bed and they're like, oh my goodness, I forgot to teach like the part 3C of that
Yes.
sequence on the second side. Now my students are walking around like they can only turn left like Zoolander, and like I feel horrible.
100%. And
That's
that's so
that's what happens,
sad.
right?
Yes, that definitely happens
That's so
because there's
sad for
like,
the students or for the teacher.
wait, are you asking me? Like, oh, I think it's more sad for the teacher, right?
Yeah.
Because it doesn't really matter for the students.
No, think of all of the stuff that we're doing on one side the rest of the day.
Right? Like all day long, we just do stuff in our
Right.
life.
So like every time you like a good example that you brought to my mind in our brainstorming was getting into the car.
Mm-hmm.
So you like every time you get in the car to drive, do you like get out of the car, get in and out of the car on the other side just to even
Obviously,
it
you
out?
even it out.
Yeah.
Nobody does that. But we don't think to
Maybe.
question that. We're not like, this is a
Yeah.
problem that I always get in the car on the same side. Like, why don't we question that? Or,
Maybe we should.
right. Actually, yeah, maybe we're bringing attention to that. Like, everybody.
Everybody, make sure that every time you get in the car on the right, you do one rep of the left.
Yeah, exactly. That's so funny.
I
And
guess you'd
there's
have
so
to do
many.
it at the end of driving. So like once you get to the place, then you because if you got into the car, got out of the car, got into the car on the other side, then you'd still have to get.
You
Oh
still have
well,
to get
no,
back in.
no, yeah. So
Travis.
wait, this is a good. Didn't you
Oh,
historically have a door issue?
I did a car door issue. You
Yeah,
have such a good memory.
I do.
The
In
driver's
this
side
instance.
car door in our car that we actually just recently sold, we don't have it anymore, but it didn't open from the inside. Like the handle didn't work. So there was like a thing where I forget, maybe it was, oh, I know, it was the window had to be rolled down. And then you had to reach your hand out the window and open it from the outside in order to open
Mm-hmm.
it from the
Mm-hmm.
inside. But sometimes, like, I would turn the car off forgetting, and then the window would be rolled up. And I would be like, oh, I can't get out. And I can't roll the window down because it's electric. I need the car on.
Yeah.
So I either have to start the car again to roll the window down, or
Or
what could I do?
I don't
Climb?
know. You're stuck.
Or I can't get out of the car, or I can climb monkey style to over the little that console in between and just get into the passenger side, and then I can get out there because that door thankfully works just fine.
Perfect. But now look at all of these reps that you've done
Mm-hmm.
in one direction. You now
Totally.
knowing that in the back of your head, you're going to have trouble sleeping tonight. You should be doing that. If you're ever in the passenger side, you should be getting out the driver's side
You're
from
so
now on
right because I
to
don't know
even
if
it
I've
out.
ever done that. But yes, these are all that's a silly but an accurate example that really did happen in our car. But in general, we just have so many examples in daily life where we do things that are not the same on sides, and that's fine because something that I found was I thought was like a really interesting realization when I learned this about the way that our brain connects to, controls, and moves our body is like our brain doesn't necessarily chunk our body into two halves, side to side.
Mm-hmm.
Like it doesn't necessarily think of our body the way that we arbitrarily, like when we're talking about the body, we layer on these ideas. But the brain is not like that's my left half, that's my right half. It just thinks of the whole, like the whole organism, the whole body that it's moving, and it doesn't like chunk us up that way. So it's not like we necessarily need to arbitrarily layer that on and create these standards or ideals based on something that it's not really how our brain moves our body anyway.
Mm-hmm. So if you forgot the second half of the sequence on the second side,
Yeah, to bring us back to that,
no,
yes.
no worries.
Thank you for. I think that it would reassure many people to know that it's really not a big deal.
You know what,
Yeah.
too? Like, I think for as much as teachers try to make things even on both sides,
Mm-hmm.
inevitably almost, I feel like when you do the second side, you go faster through it because the first time on the first side you had to spend time
Travis.
queuing, right?
Yes, actually,
So
yes.
so
I've never
sure.
thought that before.
Oh, yeah. I mean, that's been my experience as a student, and it's fine. And I guess if you were striving towards this symmetry, ideal, then you could try to slow yourself down on the second side.
Mm-hmm. Mm-hmm.
But it's probably not necessary, and it's
Because it's
just
probably
fine.
not a big deal, right?
Yeah.
To have that, because you're saying when a teacher teaches a sequence on one side, it might take a little longer because they have to describe things. But
And
then by
maybe
the
they're
second
like,
side,
maybe they've gone around the room and they're like working with somebody, and now you're in side angle on one side for
mm,
5 extra breaths, and like that's not usually all right. Well, let's make sure we hold side angle on the second side for 5 extra
that's
breaths
right.
since we did on the other side. It just is,
It's another great
you just
example
move
of,
through it
yeah. Yeah,
on the second.
exactly. And realize that our body is fine and we're naturally asymmetrical. We move asymmetrically through life. And these minor, again, it's minor versus major, right? But like these minor
Hmm.
differences, you forgot warrior two on the second side. Like it's not something to stress about at all. Like we can not worry about that.
Yeah, if you did Warrior 2 on your right side only for like a month because you
Yeah,
were like, well, I'm not
yes.
going to do it on my left side because I don't like it on the left side. Well, now you're starting to develop some asymmetry.
That
You're
is right.
yeah, that's where it's becoming maybe more of an issue. But one, nobody does that, and
Mm-mm.
two, that's much more blatant than, oh, we
Yeah.
forgot to do the pose on the second side.
Exactly, exactly. So yeah, I'm glad we brought this up just to like, yeah, reassure people that, it's nice to teach, to teach if if stylistically you want to do the same thing on both sides, that's fine, but just don't overly stress about it or don't even stress about it at all. If
Hmm.
something, and if you're a student and not a teacher, maybe just, I doubt students are really give teachers a hard time about that, but sometimes maybe they stress. I've seen students be like, "Oh, we after class, like the teacher forgot this, so I'm just going to do it right now. Like class is over. I
Mm.
need to do it in order to feel balanced. Like I need to be balanced." And so maybe we could all just realize that we're always asymmetrical. It's okay to let stuff like that go. Like our body's really resilient. Yeah, just realizations like that. But that
Hmm.
does kind of lead us into these ideas of like side to side difference as far as like yoga sequences and doing things differently that way. There are also the question of kind of this other topic we wanted to talk about today, which was just more like in the, say, fitness and strength and conditioning world when we're getting
Hmm.
into side to side asymmetries there. Like when we're talking, if it's a strength difference between two sides or a balance difference, maybe you could balance better on one side or the other. um, you've definitely come across work on this, research on this in your work, right, Travis?
Yeah. So a big part of my doctoral work was looking at movement screening, or
Yes.
movement competency screening, or movement quality, whatever you want to talk about, whatever you want to call it, where
Hmm.
you're assessing people's movement using predetermined tests, move like a battery of movement tests, and then you're rating them sometimes quantitatively and sometimes qualitatively.
Hmm.
And so there are two basic paradigms. One is whether you're performing poorly on the test based on whatever the predetermined categories are, or criteria are. And then the other is within your own body, if you have major or minor asymmetries in performance between tests that are performed on the left and right sides. So qualitatively, that could be like, let's say it's like a single leg squat,
Hmm.
and on one side you demonstrate good control and balance and strength and all of the things, knees not caving in, hips and
Mm,
shoulders are not rotating, they're staying level.
like the
um,
alignment that we're looking for, the
yeah,
form.
and so you'd rate that 3 out of 3 on the one side, and then on the other side the knee caves in, the torso rotates, you can't go as deep,
Mm-hmm.
the knee doesn't go past the toe, which you want it to, indicating a lack of dorsiflexion, et cetera, et cetera. And we give
Mm-hmm.
you a 1 out of 3, and now you have this asymmetrical performance. So oftentimes research will look at poor performance. So you're just getting 1s out of 3s across the board on your tests, or it might look at asymmetries. So it might count up the number of times you have a 1 and 3 between your left and right sides. And then
Mm-hmm.
it'll look and see whether that's related to the development of injuries. So
Like later
that's,
on.
yeah, so that's the qualitative. There's also quantitatively measuring things like jump distances or hop distances. Let's say
Right.
one-legged hops, or like forward or vertical, or it might look at strength from side to side, and then you can quantify that from left to right based on the, like, dividing the two numbers
It's like
one by the
a
other.
ratio.
Yep, take the ratio of one to the other, and usually the threshold for that is like 90% or 85%, and that's based on the fact that people who are, so those tests are usually used for people who are recovering from injuries, to try
Right.
to get a sense of where people are in their affected side compared to their unaffected side, which is an
Yeah.
imperfect measurement because your unaffected side also tends to detrain in the presence of an injury. But
That's a great point.
that's mostly, like, that's the best you can do in some cases. And then it could also be used just as a prognostic factor in healthy people, or not prognostic, a predictive,
Mm.
try
Mm-hmm.
to figure out who's at risk. But there's research that has been done on healthy people showing that a 90% symmetry measurement between sides is what we tend to see in healthy people. So you couldn't then ascribe that to an injured person and say, well, you're less than, you're at 90, so you're asymmetrical. Well, people who we expect
Right.
to be symmetrical are that asymmetrical because, again, we are inherently asymmetrical, and a certain
Asymmetrical.
degree of that is normal, let's say 10%, but maybe greater than 10%. In most injury cases, we're looking to get that asymmetry to less than 10%.
Mm-hmm.
Uh, and then I think it's a little bit harder looking at healthy people and trying to tease out whether that's a risk. I think
Right.
we're pretty sure that it's a risk for people returning from injuries in terms of re-injury, but for people who
Yes.
are uninjured, to say that that is going to be a risk factor, the evidence is pretty contradictory on that.
That makes a lot of sense. Yeah, you shared with me in preparation for this episode a systematic review by Helm et al. 2021, titled "Does Lower Limb Asymmetry Increase Injury Risk in Sport?" A systematic review. And yeah, and I read through that, and it basically seemed to conclude that just a connection could not be made between, like, and this is
Yeah,
like in healthy people for
I think
injury risk.
there were studies
Yeah,
on
like you
both
said, it was
sides.
conflicting, right?
Yeah, so, some evidence has shown it, some hasn't. The really interesting thing, I think, is that a lot of studies that have shown it haven't been replicated, or they have
Right.
been, an attempt was made to replicate them. Like, let's say one study showed that asymmetrical movement scores increase risk of injury. Then they actually did, this one group, the first author's name is Chalmers. They redid the study a year later to try to reproduce the findings, and they could not. So,
They could not reproduce the
so
findings.
no, the findings were
Oh,
not, the second time they did it,
they
it did
didn't
not
hold
show
up.
that. Yeah.
Wow.
So for something to be able to say, okay, let's say this a 10% or 15% difference between sides increases risk of injury in athletes, or in a particular group of athletes, basketball players. Well, just one study showing that percentage came from that study. You would want to be able to reproduce that study on a new cohort of people. Maybe,
Mm-hmm.
again, it's basketball players, or maybe it's a broader collection of athletes, and find that that same thing holds true, that same threshold of the 10% or the
Right.
15%, because otherwise it could have just been a chance finding, or maybe it does apply to that, the basketball players, but not the other athletes, like athletes in
Mm-hmm.
general across other sports.
Different
So anyway, the
sports.
point is that just from getting one threshold from one study, you it's it's a data point, but then if you wanted to use it more confidently within that same athletic group or across other athletic groups, you would want to validate that cutoff of 10 or
Mm-hmm.
15% in another study. And that has rarely been done.
Right. So that hasn't really been established in the research. And so, yeah, so therefore it seems that it's really hard to make a statement that asymmetries do necessarily increase or inherently increase risk of injury because it's just so conflicting
Yeah.
and repeated studies have not been done to
Yeah. So
support. That
it's
makes
not to
sense.
say that it doesn't matter. It's to
Hmm.
say that we don't know.
That's right. And that's asymmetries and their connection to injury risk. But there's also the question of asymmetries and their connection to athletic performance.
Yeah.
Like having a difference into like you're stronger on one side than the other. Could that make you worse at your chosen sport because you have that
Hmm.
asymmetry?
Right.
And I know you know a lot about this, and you shared the Maloney 2019, that review that I cited back in the intro that gave that definition for symmetry. But
Hmm.
again, it seemed like that was just suggesting that there also had not really been, there's not a link established between asymmetries and athletic performance.
Yeah. And I think that oftentimes what you're seeing from an asymmetry standpoint is an adaptation that occurred as a result of participating in the
In the
activity. So
sport.
if you look at Rafael Nadal's bicep size,
Wait,
or like
who is Rafael Nadal?
Rafael Nadal,
Sorry that
you
I
don't
don't
know who,
know.
wait a second, you don't know who Rafael Nadal is? He's
I'm
only
assuming he's like a
the
very famous athlete.
he's only the probably best tennis player ever to live.
Oh, really?
So now you know. Have
Tennis
you heard
players like
of
a
have you heard of any other tennis players?
Serena Williams.
Okay.
And there's
Okay.
Sampa Pete Sampa
Pete
Pete
Sampras, that's a good one.
Sampras, yeah.
Yeah, he's retired.
Oh, he okay, this is like from a while
So
ago.
Rafael Nadal has the most Grand Slams
Wait,
of anybody.
they do grand slams in tennis? I know that from baseball.
Okay. So side note, Grand Slams are the four major tennis tournaments: Wimbledon, Australian
Oh,
Open, US Open, and French. That
sorry
they
that
just
I'm
call them Grand
so
Slams. That's okay.
tennis unaware.
We're getting a tennis education with
Yeah.
asymmetry. So anyway, Rafael Nadal has a huge difference in his arm
Mm,
size
because
between his
he
dominant arm and his
swings on one side.
non-dominant. Yeah, and that is not hindering his performance, um, because he
Right.
hits a, I believe he, don't hold me to this, but you can hit a two-hand backhand or a one-hand backhand, and
Mm,
it doesn't really matter. The point is that, like, is he gonna bet? Is he gonna be better than the best player ever if he got his
right.
right? So I think he's left-handed. Also, don't hold me to that. But anyway, is his non-dominant arm is strengthening that and making it
Hmm.
equivalizing it to his dominant arm really going to make him better than the best player ever?
That is such a great. Thank you for pointing that out. That's an excellent example. So, in many cases in sports where it's like asymmetrical demands, that if you participate over time, your body will adapt asymmetrically to the sport, and that's a positive benefit, right? Like that. Or you so you mentioned tennis, but also like baseball pitchers, baseball batters. Like
Any
that's
rotational sport athlete,
I
yeah.
guess golf. I mean, I guess there are
Hmm.
a ton.
Yeah.
But in the case of people who participate in those sports regularly, playing asymmetrically regularly, they're probably just naturally, if you tested them, if you like put them through that battery of tests, you would come up with like they're different side to side. But it's not necessarily inherently a problem, right?
No, and if you try to quote unquote fix it, you
Yeah.
could actually interfere with that athlete, like what makes that athlete so successful. So that's why it's tricky working with high level athletes like that who do have those asymmetries, especially if they're in pain, because the last thing that you want to do is
Mm,
work with them on something, you identify an asymmetrical this or that, and then you work on correcting it, and then they're out of pain and their performance is impacted. So
that would
you have
not
to
be good
walk a
for you.
fine line with that, especially with professional athletes.
Precisely. So I think that's a pretty good look at like what might be called side to side asymmetries or like limb differences,
Hmm.
like side to side. If you look at the body from the front and you go left right, But there
Yeah.
are also asymmetries in terms, like you could, a very common one we tend to hear about, and Travis, you and I talk about this one kind of quite a bit in our work, but there's like the front to back asymmetry in terms of, let's think upper body now, and like upper body pushing versus upper body pulling strength.
Mm-hmm, mm-hmm.
This is kind of a common one that, like I mentioned, you and I tend to talk about that in our strength for yoga work together because, quick recap for people who might not know, in the yoga, a yoga practice is very dominant as far as upper body pushing. We're always pushing with our shoulders, pushing the floor away, but we have virtually no complementary pulling. So we don't really do anything that strengthens the shoulders or the upper body in a pulling manner. And so you could look at that and say that that's an imbalance, right? Like there's a push pull imbalance for the upper body in yoga.
I would say that.
Yeah, and we do try to highlight that. But and also broader than just the yoga world, there are ideas kind of in the broader fitness and strength worlds, Travis, right? About just push pull ratios in general, and these ideas that
Mm-hmm.
like people should do 3 times as much pulling exercise for the upper body than pushing. Isn't that kind of a common claim?
Yeah, it's just made up then.
What do you mean? People sure say it a
Some,
lot.
I know, some person at some point in time just pulled that number out of a hat and said 3 to 1. It's the magic ratio to prevent and fix all shoulder issues. And
Right.
it's just, there's not been, to my knowledge, any research that has produced a number like that.
That's yes, and if there's
But
no research on it,
a lot of people just blindly believe it. Like, oh, that must be some magical number.
because it intuitively sounds right or something.
Yeah.
But if there's no research done on it, then like what are the claims based on? I guess just like
I
common
think they're,
sense.
yeah, I think they're based on the idea that a lot of people just go to the gym and do bench press.
Yeah, which that's a pushing. That's a push, no pull.
Yeah.
Yeah, for the upper
Uh,
body.
and so for those people, maybe because they have been only doing one
Mm-hmm.
direction for an
Mm-hmm.
extended period of time, it would behoove them to maybe balance that out by working in the opposite direction in terms of, all right, well, now every one time you do bench press, you have to do, I don't know, two, three's a
Rows
lot.
or whatever, which is kind of the
Three's pretty
opposite.
impractical. Yeah.
Yeah.
Two rowing or pulling, like a pull up or a pull down exercise. Uh, and maybe that's fine. And maybe for yoga practitioners who have only ever their
Mm-hmm.
only experience with the movement practice is yoga, that if they were to start engaging in a strength training practice, they might bias their training more towards pulling to complement what they're doing on a yoga
Mm-hmm.
mat. But the
Mm-hmm.
truth is that sometimes, or many times, they're often not strong in either direction.
Yeah.
Even though they've only been doing
That's a
pushing, that doesn't
great
mean
point.
that they can do a really nice chaturanga. So
That's a
it's
really
not
good
just what
point.
you've been doing, but it's like, well, where has that gotten you? If you're weak in both
Precisely.
directions, then you don't necessarily need to bias one or the other. Uh, you could just, like my general approach is to just do equal amounts of both.
Yeah. Absolutely. And that's a really great point that that it's, pretty established that yoga is a pushing dominant style practice, but just because it's a lot of pushing doesn't necessarily mean people are actually getting strong because for we're not going to talk about it now, but for so many reasons, there's, a lack of real true strengthening in a progressive sense in a yoga context anyway. So it's not like they're super strong in a push, but it is still a pushing dominant activity, which means that yogis generally have, probably really lacked that activity of pulling their body towards something for the whole time that they've been doing yoga, if that's their only movement practice. So I feel
Mm-hmm.
like you and I can remember back to several years ago now. I wrote,
Uh-oh.
yeah, when I say that, then right? It's going to be something from a time when maybe I wouldn't explain things the same way I would today. But it was really good. It was like a really good direction. So basically, I wrote this article. I want to say, when was this? Maybe 2017. that was called Does a Yoga Practice Result in Imbalance, a Strength Imbalance? That's what it was called. And I basically wrote about how, just what we already said, yoga is all pushing, there's no pulling. And I gave examples of what this means so that people would understand. But I suggested in that article that because of this push pull imbalance in yoga, that yogis were subjecting themselves to a higher risk of injury and a higher risk of pain. That's what I
Mm.
suggested at the time. And I would not, if I were to write an article like that today, I wouldn't include that part because I don't. And when you and
That
I talk about this, oh, sorry, go on.
that might be classified as a nocebo.
Yeah. Thank you for saying that. Yes, it can be. Yeah, I was including a nocebo. I mean, it was good that I think good that I was bringing awareness to like, what are the actual movement demands in the yoga? Like, let's look at that, you know?
Yes, totally.
But I didn't need to paint on top of that, that this could actually predispose you to pain and injury by having, and that you need to do pulling in order to mitigate the injury risk or something. Like, that's where it goes too far. You
Hmm.
know,
Yeah, I
and
just don't think that there's any evidence or compelling evidence
that's
that that's
right.
true.
That's right. So I think in taking a step back and looking at kind of how I might look at it or we might look at it today, because clearly we do try to emphasize this push pull difference in yoga. It's not that we're trying to suggest that that means yogis are going to hurt their shoulders.
Hmm.
It's I think it's just more for them to realize that if a balanced full body strength is what they're after, like actually targeting their body 360 degrees, they should realize that yoga is not doing that for them. And if
Right.
that's a goal for them, then they might want to bring in strength training. And like we teach in strength for yoga, we include all like targeting the shoulders all the way around for true strength over time. But yeah, I mean that's the reason to emphasize that to me today. Don't do you agree?
Yes. Yes. And just for even just a novel input.
Yes.
And
Yes.
it does get complicated when you start talking about people who are in pain already, because then you do want to look at what they're doing from a movement standpoint. And
Yes.
if they're only doing yoga and not doing anything to work the shoulder in other ways, then there could be an argument for adding that, and it could contribute to the
Absolutely.
resolution of their
Adding
pain.
pulling, you mean?
But yeah, but it doesn't necessarily mean, again, that the reason that they start to feel better is because now they've changed the strength balance or
That's
symmetry of strength between
right.
sides. They might not even actually change that, and they could start feeling better really fast just because they're doing something different, or because they were told that it was going to
Hmm.
make them feel better, or who
Or it
knows
makes them
why.
feel strong. They're like, I'm strong in this direction and I didn't realize, or I'm building
Yeah,
strength in this pulling direction and I didn't even know
yeah,
I lacked that. And now I'm
yeah.
building that.
So
And
it could contribute to feeling better, but we
that's
don't
right.
necessarily know that the exact reason that you feel better is because you've restored the symmetry between your
Yes.
pushing and pulling muscles, because we don't even really know. There's there are articles showing like, oh, you should be able to do this, it's the normative data for this many push-ups or this many inverted rows, which is like
Oh, that's how you might
it's a
compare
body
push
weight
pull.
exercise. Yeah, yeah, where you pull yourself up towards the bar.
Hmm.
Anyway, there are norms for that, and you can look at that in athletes and compare the push-up strength to the pulling strength, and maybe show some sort of ratio between those things. But it's not like very
Cut and
definitive, I would
dry.
say. Yeah.
Yeah, that makes a lot of sense. Yeah, like how are we even assessing the strength and balance and
Yeah. And again, what is the magnitude of this difference? If you I have a friend who's a rock climber,
hmm
and she's, I would say, fairly atypical, at least maybe not among rock climbers, but among average people walking around, in that she can do a bazillion pull-ups. Like, she could do a set of 10 pull-ups no problem, and she would not be able to do 10 push-ups.
and this is because rock climbing is a pulling sport, right? Because you're pulling
Yeah, you're
yourself toward the
pulling.
rock.
Yeah, and like climbing up a wall. So it's
Hmm.
all back muscles and very little pushing yourself away
That's right. That's
from
such a good
anything or pushing something away
example.
from you. So she's adapted in the opposite. Like most people,
Most people
they're
are
going
the
to have a
other
much
way.
easier time learning to do a push up than they are going to be able to get a pull up.
which is a perfect pulling exercise. Yeah.
Yeah, she's the
She's the
opposite. She can do pull-ups all
opposite.
day, but her push-ups are not
Wow. So
her
because
forte.
her dominant activity is a pulling one, then she's just
Hmm.
like stronger that way, which that's like, yeah, that seems like kind of a surprise. Like it's not what you
Yeah.
picture with
So
most
for
people.
her, she definitely shouldn't be doing a 3-to-1 pulling to pushing ratio.
That's right.
But
It
it's
would
all case
just,
dependent.
and I think that's with so many of the things and the questions that we talk about, it's often like about context and about the individual, right?
Hmm.
I certainly think for longtime yogis who have yoga's been their main form of a movement practice and it's all push, if they're interested in just full body strength, then bringing in pulling is great, and doing something like a well-rounded strength program is great. But it just depends on the person. We can't just like slap a standard or a label on everyone and be like everyone needs a 3-to-1 pull push ratio.
Yeah, I mean, I hate when people make those sweeping generalizations, but that's the crux of it, is that how can you say that for everybody? Let alone the logistical challenges of, are you really going to do 3 sets of pulling for every, like, what does that even look like?
Like realistically in a
Yeah.
workout, like
Yeah.
your
Okay. So
time.
if I do 10 push-ups right now, then I have to go to do 40 rows.
Hmm. That's just not gonna
Yeah.
that doesn't
I
really
don't think you
fly
need,
for
and I don't
someone's
think you need to like eye for eye, tit for tat that, you know?
right. I think that's a really good. It's just so easy to oversimplify things and see them in that. Yeah, eye
Yeah.
for
Which is
eye,
exactly the same. We're talking front to back. It's exactly the same as what we just said with side to
side to
side stuff.
side.
Yeah.
Yeah.
Although
Yes.
with the side to side thing, one thing I will say is like, we were saying that you don't need to worry about, like, don't sweat the minor differences. But if you
Yes.
are, let's say you're engaging in a strength training practice and you notice like, oh, I can do,
Yes.
you're doing a single arm dumbbell or kettlebell overhead press,
Yep.
and you find that you can do like 10 reps on one side and 6 on the other with that weight, like,
That's a pretty big difference, right? You would
yeah,
say.
yeah, that's a 60% or a 40% difference. That could be a case where you would want to
Yes.
work on equalizing those or equilibrating those by doing a little bit more on the weaker side.
And that's what you have told the many people. We've gotten this question quite a bit in our Strength
Yeah.
for Yoga, like with our community. People ask that a lot because they notice, like, hey, I
Hmm.
can do more on this side. And that's usually what you suggest, right? Is it depends on
Yeah.
like how big the strength difference is, but
Yeah. If you're doing 9 reps on one side and 10 on the other, like, no
right,
biggie.
that's not a
But
biggie.
yeah. And it's
Yeah.
also hard. It's, it's hard to even say, like, that's not really a 90% difference, because maybe you could do 9 3/4 of a rep, but you call it 9,
Oh,
and then you're like,
right.
well, you're actually closer to 10 than you are
It
to
rounds.
9. But
Yeah.
the way that you would really be able to tell that would be if you had dumbbells, let's say 0 to 50, and on the one side you could do 50 pounds, and the other side you could do like 50 pounds for 10, and the other side you could do 45 pounds for 10. Well,
Hmm.
now you can actually, you're, instead of dividing the weight 9 reps by 10 reps, you're dividing, or sorry, instead of dividing the reps 9 divided by 10, you're doing the same reps on each side and dividing the weight that you did on the one side versus the weight you did on the other. So 45 divided by 50 is a tighter, you know, that's still, that's like plus or minus 5, because of the dumbbells come in
Hmm.
increments of 5,
Hmm.
versus like like 9 reps versus 10 reps is just it's not, it's not a very rigorous way of trying to calculate that symmetry difference.
That's really interesting. I had not thought about that difference and how
That's
you might
something actually
ascertain.
that I learned from a Australian physio friend of mine named Tim Rowland. He
Oh,
works a lot
I know
with
who Tim Rowland
ACL
is.
athletes. Yeah, he
Physio Network
works a
guy,
lot with
right?
Physio Network guy. He works with a lot
Hmm.
of ACL athletes, and when you're trying to calculate symmetry for return to sport testing for limb differences,
Right.
you know, you have to find ways of getting accurate numbers, and the reps is like the last resort. If you have to, if that's all you have, then divide the 9 by 10 reps. But if you can do it in a way where you can divide the weights, then that's going to give
Wow.
you a better metric.
And that sounds really smart, especially in a context like that, where it really needs to be more like technical and accurate in that
Yeah,
like
yeah,
clinical
yeah.
context.
Right. Yeah. When you're trying to make decisions about whether an athlete is ready to return back to a
Mm-hmm.
contact or collision sport that they previously suffered an ACL injury in, you want to be making sure that your tests are as rigorous as possible. When you're looking between your left and right sides as a recreational strength trainee and
Yeah.
yoga practitioner, like if you can still continue to practice yoga if you have do 9 reps on one side or 8 reps on one side and 10 on the other. You are not at risk.
Right, right, exactly. And so
But
yeah.
6 reps on one side and 10 reps on the other, in down dog, you probably are bearing more load through one shoulder than the other. Not to say that that's going to guarantee
Mm-hmm.
you get a shoulder injury during down dog, but just to say that you might in poses where you're loading or moving through both arms at the same time, you might not realize that you are loading one
Yes.
side more than the other.
Because
Which
sometimes that's, sorry, what were you going to say?
which is why it's helpful to do single side
Mm-hmm.
exercises, which are maybe easiest to do in a strength and conditioning setting
That's
using
right.
2 independent dumbbells so that
Because
you
you can
can
really
actually
measure
feel for
it.
yourself. Yeah. So I think many of our strength for yoga members are
Mm-hmm.
coming to this strength practice from yoga, and might not have they might have realized that they had mobility differences between sides,
That's
but maybe
right.
they didn't realize that they had strength differences until they took on this strength practice where they were able to do one side at a time.
Absolutely. I think that's one of the great benefits. And that's one of the many reasons why we would include like unilateral or one sided exercises in our strength for yoga programming, because it just helps people learn more about their body and their side to side differences. And we've gotten those comments from people repeatedly for sure. Like doing some, like a squat with two legs down, like there's doing a squat bilaterally with both legs versus doing a single leg squat on one side. And then that starts to expose for you, like, oh, now I can
Right.
actually see I'm isolating one side. I may have these differences I didn't even realize. And
Mm-hmm.
yeah, that becomes more apparent when you actually take on like a structured, something like a structured strength program. So, like, maybe counterintuitively, it's just one of the many ways that we think of yoga as being a practice that helps us learn about ourselves in so many ways. But I think that that's one of many ways that a strength practice can also help you learn about your
Yeah,
body.
it's really hard to in chair pose say, "Oh, I'm actually putting 70% of my weight in my right leg than my left." Because
That's
actually,
right.
even like within yourself, that's going to be hard to feel. Even for people watching you visually, skilled observers, physiotherapists, physical therapists who are trying to identify that, it's also hard to see with the
Yeah.
naked eye. You actually do need pressure mats or force plates
Right.
to be able to spot those differences. Maybe 70-30 you could see, but 60
Right.
40 like that might be meaningful for, like, let's say from a ACL return to sport.
Yeah. If it's
You're,
that context, yes. Yeah.
yeah, and that might not be something that you can just see with your eyes.
Absolutely. Right. And so I guess to kind of just start to round out this whole conversation and all these little details that we can look at with regard to asymmetry and symmetry, and kind of re-emphasizing that point about there being a difference between minor asymmetries and major asymmetries, how they might
Mm-hmm.
affect our bodies and how we might think about them differently. So coming back to you and your body, Travis, and how you are in this beautiful body that is,
Oh, thank you.
we would say, you're welcome, a major asymmetry. I wonder if you just have a couple thoughts to share with us about like your experience in your body, maybe with regard to yoga, or really just anything that you'd like to share with us, but just
Sure. Well, yoga is an interesting one. I don't know if I've talked about this before, but like coming to a yoga practice,
mm-hmm.
especially when I was first starting out, like I don't know what I'm doing. I don't know, and like the teacher doesn't know how to often work with me. And like
Yeah.
most teachers are are good. Like
Mm-hmm.
they're helpful and they find creative ways to do things. But the backtrack, I don't do everything the same on both sides.
Yes. Right.
And so
Yeah.
sometimes that's like that might mean I do the same side twice because there's no point
Mm-hmm.
in doing the
And
other
doing the
side,
other side.
or I just can't do it like a tree pose. I
Right.
just I stink at balancing on my prosthetic side.
Because you have
uh
no knee control, right? Or is that one of the reasons?
I have no ankle or knee control.
in the
So it's
prosthetic
just,
leg.
yeah, it's all of my balancing strategy has to come from my hip,
Yeah.
which is, as I mentioned at the beginning of the episode, also relatively weak, or is relatively weak. And then just like stacking my shoulders over, like
Mm.
centering my center of mass over my foot. So anyway, it's tricky for me to balance. Therefore, sometimes I'll do the same thing on two sides,
And you don't really
or
worry, you don't worry about that, like, I'm going to be imbalanced now.
well,
Like, people
I
might.
I mean, everything that I do, like I take every step, every set of stairs that I go up, I go up with my right leg because I don't have active knee extension. So
Right.
my whole
Right.
day is spent 70% on one side and 30% on the other. And it's something that I try to go against my habitual pattern. You know,
Mhm.
if I notice myself leaning into one side more than the other, but at the same time, like I'm more likely to fall over if I have more weight in
Right.
my prosthetic side.
Yeah.
I'm just much more
Yeah.
stable on my other side. So I don't do things, I like in a yoga class, I don't do things exactly the same on both sides, and I don't
Yeah.
worry about it. But
Yes.
that I
I
I
love that
don't
you
I
don't.
don't do things on the same on both sides in general, and I think a lot of people
Yeah.
don't. And they probably don't worry about it in their day to day. And if they are worrying about it on the yoga mat, maybe the realization that they don't worry about it on their day to day might help themselves feel a little bit
Mhm.
less worried about it on the yoga mat. But
Yeah.
anyway, teachers usually just let me be and let me do my thing,
Yeah.
or they might come up with creative suggestions for how I can modify a pose on my affected side so that I'm getting the benefit, even if it's not looking exactly the same. And
Absolutely.
that's true for anybody, anytime.
Yeah. Yeah.
Sides, as we've been talking about, sides are different, and sometimes you have to do things differently from one side to the other. I just often have to do things differently, and sometimes very
Mhm.
differently. And
Mhm.
so I've found ways to do that, and over time in a yoga setting and in a strength and conditioning setting. But always the first time, it's like, all right, well, I have to figure this out. What am I going to do? And
Yeah.
it's inevitably a learning process, as with
Right.
anybody and anybody's body, of what's going to work best for me, and knowing that it's not going to be the same on both sides, and that's okay.
Mhm.
But
Totally.
how can we it's a ever evolving thing of how can we make this better on, so I can get some benefit out of it on the second side.
That's right. And I suppose as long as you're exposing yourself to new activities or a yoga class where there are new movements all the time, then it is just naturally going to be continually evolving. Like that's not going to stop. So always
Hmm.
just like, yeah, figuring out how you can fit your body into what's being offered or make that
Yeah.
work for you.
And I'm 32 years old, and I just discovered that I could sort of do pigeon, or something pigeon like, with my prosthetic leg forward. I could never get comfortable bending that knee and trying to like get pigeon leg on the front of the mat.
Is that because of
May
like the hip rotation, the rotation?
Yeah, yeah, I just would like fall over. And maybe
Okay.
putting a block underneath that
Mm-hmm.
hip,
Mm-hmm.
the
May
hip of
help.
the pigeon leg would help. But what I realized was I don't have to bend that front leg. I could just have that forward
What?
in
Like all
more
the
of
way?
like yeah, or you know how we said we don't have to have that thigh or the shin perfectly
Pa-
parallel to the mat. So
yes.
maybe that leg is kind of going at an oblique angle, kind of like it would
Yes.
in pigeon if the shin were, if it were at like a 45-degree angle.
Yeah.
And then I'm just, I don't know, finding a way where I can do it without falling over. Maybe I need a couple of blocks underneath me, but I'm still feeling like I'm getting some of that rotational hip stretch. And but like
That's
before, I
so
just
great.
did it on my right leg both time, like
That's what you
right
would
side,
do.
left
You
side.
would
I
just
did right because it felt good. I'm like, all right,
yeah,
I get to
because
do
you
double
like
the time in
pigeon.
pigeon. I like
Yeah.
pigeon. But then recently I found like, oh, I don't have to bend that knee because I don't have muscles crossing the knee that make
Yeah,
it different for whether I straighten or bend the knee.
that's
So
right.
I can just
It
keep
doesn't
that leg straight.
matter.
And it looks kind of funky, but Doesn't look the
It
same
does
on both
not
sides.
matter what it looks
And
like.
yeah, it's totally okay as long as I'm feeling what I want to be feeling.
That is so cool. And after like, I don't know, 16 years of a yoga practice for you now, like you
Yeah,
finally discovered that.
it took me a long time.
That's super cool. I want to see that pigeon setup of yours. I'm so glad you've discovered that. And I would just like to reflect to you that you are one of the, if not the most impressive person that I know in so many ways. Like, first, compared to people who were born with two legs, you are still incredible. I don't know if our listeners really
Actually,
know this about you, but
I,
you're a super really advanced, like, I guess I would say advanced, that's not the best word, but you're just a super impressive athletic person. You can
well,
do
thank you.
all of these amazing like calisthenics. You're the strongest person in the upper
Well,
body I've ever
I have an
seen,
advantage because I'm lighter in the lower body.
because you don't have
It's
that
true.
leg. You
Yeah.
have an
Yeah.
advantage, but it's
I weigh
still
about 15 or 20 pounds less than the average person of my stature who has two legs. So that is a favorable, it
Mhm.
comes in handy for exercises where body weight and upper body strength
Totally.
rule
See,
the
like
game.
human flag, like some of these calisthenic things that you can do, like the human flag is one, right? And
Mhm.
a front lever. I don't know if our
Mhm.
listeners know all these, but
Yeah.
um, and of course, crazy variations of pull-ups and muscle ups. I watched you do over 30 pull-ups in a row. Like you, it's just, yeah, it's very impressive. For
They
people
were
for whom like one pull-up is like
they
a
were one at a
huge
time,
goal.
but I did do 30 in a short amount of time.
Yeah, you did.
My
So
life goal is to
anyway,
do 30 in a row, but I'm not there yet. I
oh,
did
okay.
27 once. That was my
That's
best.
right. So just to emphasize, like, you're such an achiever, and you've
Well,
done
thanks. And
so
I think
much
that
in
that's like the point, right? So, um small
yeah.
asymmetries are nothing to write home about, but even big asymmetries
Hmm.
don't mean the end of the world,
No,
and I'm living proof.
I love that you emphasize that. I think that's a great takeaway point. That yeah, yeah.
From a function standpoint, there's much that having a really significant asymmetry doesn't prevent you from doing, and in fact for me it has allowed me to do many
That's
other
right.
things.
That's right. And so looking at it in that way is just like even more reassuring and more positive. And yeah, this through this whole conversation, we've kind of been talking about there are minor asymmetries that we don't need to worry about. And then there are major ones. And as though it was like implying you inherently need to worry about those. And that's not the case clearly.
Yeah,
Um,
well, it's just not a doom and gloom
yes.
scenario.
Yes. It does not need to be doom and gloom. And someone
Yeah.
like you you're such an inspiration and an amazing example of that.
Well,
So
thank you.
thanks. Yeah, absolutely. Thank you for just sharing about some of your experience, and I hope for some of our listeners who maybe didn't realize that about you and your body and your movement, maybe they can get to know you a little bit more this way and appreciate some of what you've accomplished, which is just a
Well,
ton.
thanks.
You're welcome.
I'm more than just a smart brain.
You are, but you're that too. I mean, that's just yet another reason why I'm very impressed with you. And I feel very lucky to get to collaborate with you on so many things, including this podcast and our Strength for Yoga offerings. So, yeah,
Well,
Travis is a gem. Everyone should realize that.
well, I'm equally lucky.
Well, thanks for saying that. And with all of that, Travis, do you think we've kind of done a pretty thorough job discussing asymmetry and hitting on some good points?
I do. I do.
I do too. I think we covered, yeah, really good material on this topic. And I hope our listeners leave having learned some new and interesting information about this and just maybe a shifted perspective about symmetry and asymmetry. So thanks so much for listening. And thank you for having this conversation with me, Travis.
Thank you, Jenny.